apologize for the mix-up yesterday. It's a long story, and I was ready to be done at the end of the day, but I'm so glad that you found us. And I want to actually send this over to Sandra to introduce Caitlin from the health unit. Do you mind doing that, Sandra?
Nope, I'd be happy to do that. Well, good morning, everyone. It's good to see you all on the call. I hope you're doing well. I have had the pleasure of working with the health unit over the last number of months, both through the emergency childcare and now with the reopening plans. And so most recently, I've been working with Caitlin Burnside. And so I'm pleased to introduce Caitlin to you. I see that Caitlin has a couple of the health inspectors on the call as well. I see Ravi and I'm just trying to see who else is on.
And Brian.
Forgive me for that. And Brian. So welcome to you all. We're really pleased that you're able to join us today. And I do just want to say Caitlin and her colleagues have been instrumental in helping us compile these policies that are required for reopening. And so I hope that you've all had an opportunity to review the package that I sent out yesterday. I do want to just say everything that has been sent out has been approved by the local medical officer of health and is ready to be used for supporting your reopening. And so Caitlin is going to just walk you through the documents today and provide an opportunity to allow you to ask questions if you have questions. And then, of course, once your staff have done the video training, if you have additional questions related to the video training, then you can direct those to your individual health inspectors for answers specific to your organization. So I'm going to turn it over to Caitlin now and take it away, Caitlin. Thank you.
Sandra, sorry. I just realized I didn't do housekeeping. Can I just do that, Caitlin? I'm sorry. Just
of course.
A reminder that if you hover your mouse near the kind of the lower part of your screen, you'll see a taskbar that has the video and the mic. If you can make sure that your mic is turned off unless you're speaking, that just really helps with background noise and also our connectivity to the presentation. There is a little chat box. You'll see a little box to the right. And if you have a question, you can put it there. Or some of you may have a hand and you can also raise your hand. And I'm sure Caitlin will have the opportunity for questions near the end of the presentation. So thank you, everybody. And welcome, Caitlin.
Well, thanks, everybody. My name is Caitlin Burnside. I'm an infectious disease nurse at Peterborough Public Health. I may have worked with some of you more in an immunization role. Just due to the pandemic and kind of ongoing announcements, we've been trying to shuffle around, and I was called in to support the daycares with the wonderful surprise announcement of reopening daycares that was made on June 9th. So as Sandra mentioned, I had been working with her closely on the policies. So all of the policies that we review today are based on the operational guidance during COVID-19 outbreak document that was released by the Ministry of Education. Although brief, that document does have lots of information for daycares who plan to reopen, and it should be reviewed. So Peterborough Public Health will update its website with resources, but just watch for ministry announcements as they come through, because one of the themes of this pandemic is ongoing changes. So just something to be aware of. I also wanted to mention, I just received it this morning, but it sounds like daycares received something from the Ministry of Environment regarding water requirements. I haven't got a chance to review the documents yet, but after, I may just try and forward them to the group or have Sandra or Becky forward them out. And again, you may have already received them. I think it might have gone out to you guys on June 11th or 12th, but it basically just talks about safe water consumption and what to do in your facility when it hasn't been occupied in a long time. Last night, we released our training video for daycare staff. So you can refer your staff to review this video. It's actually only 20 minutes, so that's really good. On general infection control measures, a lot of the information is complete review. You'll probably be doing this throughout the year. The more detailed stuff will be in these policies. But we thought it was most important for daycare operators because they may have to adapt the policies to kind of fit their facilities needs depending on where you are. So another thing is, just wanted to touch on that I would recommend having staff review some PHO videos on donning and doffing PPE if they're assigned to ever taking care of a child who becomes symptomatic. So you may have only some staff that would be expected to do that, and those staff should be familiar with donning and doffing PPE. And in the training video that we uploaded to YouTube, we have a documents and references slide. And that slide includes the videos and has links and things like that. But they'll also be posted on our website too. So the video that we recorded is actually a slideshow and it is available on YouTube. So if you go to youtube.com and search for Peterborough Health, PTBO Health, I should say, that's where you can find the daycare video. I forwarded the link to Sandra last night and I think she got it out. So you can also access it that way. And we're just trying to update our website. We wanted to try and get things up and running for the daycares as quickly as possible. So of course we may edit some things, but the majority of things will stay the same. For emergency childcare centers that have been open all along, there isn't too significant of changes. The information just seems more detailed. So just to start off with, Sandra sent out a bunch of the documents last night, but I think we can start off with the checklist. So it's called the COVID-19 Operational Requirements Childcare Reopening Checklist. And I'll just give a minute for everybody to open this up. So this checklist was actually adapted from another health unit, and I've seen tons of other health unit jurisdictions adopting this tool, and it's a really good section by section checklist that touches on all the things required by the operational guidance document. So it's just good to go through as you're kind of preparing to reopen. So the first part on this checklist is at the entrance of the daycare, so passive screening and signage. So there has to be signage at the entrance prompting staff, parents, guardians, and any other essential visitors to make sure somebody in the facility is aware that they're there, and to notify anybody if they have any symptoms. There should also be reminders on performing hand hygiene, following respiratory etiquette, and using alcohol-based hand rub. And then it kind of moves down to the next section, which is actually active screening. So to perform the active screening, that's when you're actually going to use the screening tool that Sandra sent out to screen staff, children, and visitors. The tool is very straightforward, but if you have any questions, of course, we can go over that. This was made up for the emergency childcare centers, and it's just been edited slightly. I think the most important thing with when you are doing active screening is looking at the tool and actually referring to the Ministry of Health has a document on symptoms. I talk about it in the training video as well. But because we get information ongoing about different types of symptoms and what symptoms are common in certain populations, it's important to continuously review that document to make sure that you're not missing any updates. And the thing about COVID is, although it's a respiratory infection, it can present with atypical symptoms that are kind of more enteric based or stomach based. So you, especially in kids, so some kids will present with nausea, vomiting, diarrhea, abdominal pain. So just looking for any kind of unusual symptoms. Is there any questions on that at all? Okay. And then in terms of protecting.
Sorry.
Oh yeah.
Sorry, I had a question. Just with those atypical symptoms like fever in young children that are teething, for example, does that still fall under the same, like, are we to exclude them from our groups when we know it's teething, or?
So if you know it's teething, then you're not expected to exclude them. Or if you know that a child has allergies, you don't have to exclude them. You can always err on the side of caution and say, you know, I'd like you to follow up with your family doctor first, because you shouldn't be expected to kind of make that decision. But if you're comfortable with it and you know that the child has been teething for the last couple of weeks, absolutely, you can use that judgment.
I see that Margaret has her hand up as well.
Hi, I was just wondering, kids under the age of 4, a lot of them, technically have runny noses 7 days a week. Doesn't matter what you do, you're constantly wiping noses. Now, what I'm concerned about is, one of the questions is, does the child have a runny nose? And then at the bottom it says, if you answered yes to any of these questions, the child cannot be admitted. So my worry is that if I decide that this child knows all the time, and he's got no other symptoms, and another parent knows something, I just want to know what the protocol would be. Do I absolutely not allow that child with the runny nose in the center? In which case, we'll probably be empty.
Yeah, so it's actually the same answer. So if you know the child often has kind of a nasal drip or seasonal allergies, then you can use that judgment call and allow them entry. If you're not comfortable with making that decision, then you have the discretion to use that tool and say, you know what, I'm not comfortable with letting the child in. Please follow up with your family doctor. And if it's determined to just be a usual thing for that child, then you can come back. But if it's not, then you have the right to say that child can't come into the daycare. So actually, if you look at the wording, so it's runny nose / nasal congestion without other known cause. So if a child has the constant nasal drip, that's recognized. That's okay. So just going back to protecting the screeners. So just making sure that screeners are able to use at least a 2-meter distance between them and the person being screened. If they are closer than that, they should use kind of a plexiglass cover or a surgical mask and eye protection if you can't do either of those things. And making sure that a logbook is tracked of all the individuals who are screened at the facility and their screening results. And there's some bullet points on the information to capture this information is also outlined in the operational guidance document. So if anybody screens positive, for instance, a child comes in with a cough and a fever and does screen positive, then you will want to notify public health and just report it to us so we are aware. And depending on whether the child was symptomatic at the daycare or has siblings and things like that, public health will make a recommendation on whether those siblings can enter the building, whether they can't, that kind of thing. So we'll help you out there. Just the next section, so ongoing monitoring. So once people are screened for the day, you just want to make sure that staff and children are monitored quite closely for symptoms. We know that COVID can spread most easily when the person is symptomatic. So if it's a staff member that develops any type of symptom, they should throw on a mask and just leave the premise immediately. Oh, Kathy, do you have or Danielle, do you have a question?
Yeah, you were getting to it down in the ongoing monitoring, but I'm concerned about the word report a suspected case.
Mm-hmm.
If I send a child home with a fever, or diarrhea, am I suspecting they have COVID and I'm contacting you immediately? Because we send them home all the time with that kind of stuff.
Yeah, well, the point of kind of letting us know is just so it's on our radar. Okay. So we simply know that somebody at your daycare may or may not receive testing for COVID.
Okay.
And so it's not a surprise for them. And if the parents have any questions on what they should be doing, then we have knowledge of what daycare they attend and things like that.
Okay, so, and I don't know if you can answer this question or maybe Sandra will answer questions later, but in terms of the serious occurrences, it also says a suspected case. So every time I send a child home with diarrhea, I have to file that as a serious occurrence?
Yeah, I'm actually not too familiar with those serious occurrences. Okay. Yeah, I'm not too familiar.
I'm just concerned that I'm going to be filing a serious occurrence almost every day. Like Margaret said, kids have runny noses, kids get diarrhea, they get fevers all the time. And if I'm reporting that, my goodness.
Yeah, no, I'm not totally sure. That's kind of more of a licensing requirement, and we don't really.
Okay.
I don't even know what a serious occurrence really is for daycare. So.
Okay, thank you.
Yeah.
I see that Sandra has her hand up, and then after Sandra, because I'm assuming she's going to answer that question, then we're going to go to Ema because she has a question or in the chat. So go ahead, Sandra.
I'm actually going to defer to Jill because Jill's had experience with it in the emergency childcare, and so her information will probably be most correct.
Okay, I can speak to that. The direction that I was given is that if a child goes for testing, we are to send in a serious occurrence. If there's no testing and they're back in 24 hours, then there's no reason to send in a serious occurrence. So as a family member or a child goes for testing, then we have to report it as suspected, and I notify the CSM and the ministry and file a serious occurrence.
Thank you, Jill. Ema, I see that you have written in the chat, are we able to pre-screen electronically before a child is dropped off?
It would be best practice to screen them in person.